Oral mucositis is well recognised now as one of the complications or the side effects of some of the cancer treatments we use in the myeloma setting. And it can be quite mild, so patients sometimes talk about a bit of discomfort or some taste changes in the mouth. But in some cases, for example in the transplant setting, it can become quite severe, and at that stage people talk about sometimes difficulty talking, and they talk about quite severe pain. So from mild to severe. The actual effect on the person is the person may talk about taste changes that they've noticed. They sometimes talk about their mouth feeling a little bit different. They sometimes notice that the saliva is a little bit, it's either less or there's more of it. Sometimes they talk about pain and discomfort. Sometimes as it becomes increasingly a problem, people talk about finding it difficult to speak, maybe find it increasingly hard to swallow. Sometimes people talk about their mouth being a little bit swollen. Sometimes people, they begin to develop an infection. All of these things, it's really important that you talk to your doctor and nurse about. And I would emphasise there is always something we can do about this. This is not something you just need to put up with. Talk to us and we will help you with this. So in our mouth, we have cells that are being replaced all the time. As I speak, my cells are being replaced, and that's a very healthy and natural process. When you give some of the cancer treatments that we use in myeloma, that process can be interfered with. We know that the drugs that we give people, while they will deal with the cancer, they can have side effects. So for example, if we think two of the drugs that we use in myeloma, say doxorubicin and melphalan, we know that both these drugs can affect healthy cells. And on the side of the mouth, in fact throughout the mouth, we have cells which are very important to protecting us, and those cells can be affected by these drugs. So the role of the nurse and the doctor is to support you as the patient to address any of these changes that you notice. So what are the treatments that we would give for treating mucositis? Well, one of the things we'll want to do is we want to make sure that there's no infection there. So often the doctor and nurse may want to carry out a swab, and that's just really to identify if there's any infection, and then we would treat it. Sometimes you might be asked by the doctor or nurse to take tablets to try and prevent infection. Obviously, if the person had any pain or discomfort, we want to address that, and there's many different ways we can address that. Sometimes we will give a particular type of mouthwash that the doctor would prescribe for you, and you would be asked to swill that around your mouth, and that gives a local effect. And sometimes you might be asked to take a stronger pain-relieving drug. An important part of the treatment is trying to continue that good mouth care. And if you find it difficult, I would encourage you to talk to your doctor and nurse, because sometimes you may need a bit of help with that, and particularly the nurses would be very happy to help you with that. Oral mucositis is not always an inevitable part of cancer treatment. I think that's a very important message to get across. Now, there may be elements of it we can't prevent, but we certainly can reduce it. And I think that in order to reduce it, there are some very simple things that we can help you with. So some of the things that you can do for yourself are very simple. The best thing to do to try and prevent oral mucositis is good oral care. So what is it you do normally to care for your mouth? So most people will use toothbrush and toothpaste a couple of times a day. So you may want to increase that a little bit. If you have dentures, always remove the dentures. I know that might seem obvious, but remove the dentures, clean the dentures, because this can be a portal for infection. I'd strongly recommend that you start thinking about using a salty mouthwash a couple of times a day. Very simple thing to do. Get a glass of lukewarm water, put a little bit of salt in it, and use this as a mouth rinse. Swill it around your mouth, and then follow this by a cold rinse. I would advise you to avoid most of the over-the-counter mouthwashes, because you'll find that most of these have alcohol in them, and you may find that may cause further irritation. Now, outside of the cancer setting, these mouthwashes can be very good, but I think for somebody going through treatment, such as doxorubicin and melphalan and other such drugs, I would say that the Salty Mouthwash is the best. The other thing that's important is to talk to your doctor and nurses, because there are some things that we know that there are some medicine products that we can use to try and help prevention. So talk to your doctor and nurse about that. They'll know what they are. Lifestyle and diet can affect oral mucositis. So we know that there are certain people more at risk of oral mucositis than others. And some of those people at more risk are people who take an awful lot of alcohol. So high intake of alcohol can affect the mucosa. And we also know that people who smoke or continue to smoke, this also can affect the mucosa. So I would encourage people to moderate alcohol intake, and I would encourage people to really try and get support around stopping smoking. So this is important. I think after that, I think it's really, trying to eat a healthy diet, encourage you to continue eating as you normally would. Sometimes, not often, but sometimes oral mucositis can be quite uncomfortable, and people find it difficult to talk and sometimes difficult to swallow. Obviously, we want to provide good pain relief for that. It's important that people eat and they drink, so we need to support you with that as well. So we work very closely with our dietitians. So the first thing we would do is probably very simple measures about maybe supporting you with different types of food. Sometimes, I would encourage people to experiment with their food. So some patients find that they prefer a spicy type of food because they can taste it, and other people find that that's more difficult. Sometimes people will move towards soups and drinks, but if they find it difficult to swallow. In severe cases, and these are rare, but in severe cases, we with the dietitian and with the doctors, we can work together to, perhaps feed a person through a tube. The person's fully awake, fully conscious, but they would have a feed which complements any food or drink they can take themselves. And in some cases, we can give support through intravenous. So people are very familiar with intravenous fluids. We can also give a form of intravenous food as well. People often ask, how long does oral mucositis last? And it's very difficult to answer that question, because it really depends on the individual, it depends on the type of treatment, and it depends on how much of treatment a person has. But I would say that full recovery from mucositis probably takes months after the completion of the final treatment. And certainly for those in the transplant setting, it may take much longer. It doesn't mean to say that they can't live a normal life, but it's just being aware that they may have slight changes in their mouth for a number of months following treatment. I would really encourage, I really would like to stress that there is always something we can do about this, and we're there to support you.